Juliette Kayyem and Dr. Anne Rimoin. She's an infectious disease expert and virus hunter. We just got an update on coronavirus figures a moment ago. It is now 58 dead, 2,816 cases in the United States. It's likely much more than that, but there's been a lack of testing, so that number, no question, is going to continue to rise. Doctor, I want to begin with you. You've seen the scenes in Paris, in Madrid. Is it time for the United States to approach a similar lockdown as a more serious option to consider?
I think that we all have to take this very, very seriously. And if the American people aren't going to take it seriously, then we have to be helping them to move towards this very, very serious social distancing. People need to really stay at home, stay away from large groups, and to avoid being in places where virus can spread. And unfortunately, what we've seen is large play dates, lots of people going out to restaurants, lots of people out in bars. These are all of the scenarios that we want to try to avoid. People really need to take responsibility. If they can, stay home, because that's for the common good. It's good for everybody. And we have to not just think about ourselves. And I think that this is one of the issues that that we really are having trouble communicating, which is it's true that children, young adults may not have the same kind of serious outcomes as we are worried about for older people, but they are still able to pass the virus. And in fact, many of the young people in their 20s and 30s do have serious disease. So this isn't something to take lightly. Everybody needs to take it seriously.
Now, Juliette, we keep talking about where other countries are heading very quickly with near or total lockdowns. Yeah. I have a hard time imagining that something like that could be installed in the United States. How do you even enforce people staying in their homes, but anything for essential travel?
Well, I mean, you have mechanisms of the state to do so. We don't want to get there, certainly, right. But you obviously have law enforcement mechanisms. I think the way to conceive of it in the United States is there'll be broad shutdown, so, you know, airport travel, anything that's regulated by the federal government, say rail travel, even interstate highways if it comes to that. I don't think it will, but just those are the options that we've played through in the past. And then what you might see is very localized, the equivalent of a quarantine or a lockdown under either local rules or generally state rules. Governors have tremendous powers when it comes to this, and so it's just important to, you know, they have an authority to either isolate an area or contain it. We don't want to get to that stage. And as the doctor was saying, you know, I don't get what's going on. I get these texts from my girlfriends like, oh, we're having a play date. I don't know what else to say, but even from the Homeland Security perspective, you know, we're in for the long haul, and you are home. That's what it means, and except for limited engagements or walks or whatever else. Yeah,
and Juliette, staying with you, we just saw Georgia authorized the call-up of as many as 2,000 National Guard troops to help some of those who were aboard the Diamond Princess cruise ship. It's not lost on anybody that those troops, those Guard members, and ones in other states could soon be asked to help keep the peace elsewhere.
That's exactly right. So to be clear, they're not being asked to keep the peace. There's a complicated series of laws. They are serving under the governor as the state, under the state guard. We've had plans for this, so people should not get too anxious. Whenever state capacity gets limited and, you know, sort of everyone's sort of stretched, you'd want the guard to serve to support in things like traffic control, crowd control, supply chain. Now, that's the state side. The federal government has a large military as well, which also has worked with civilian authorities to provide assets and manpower, woman power, to be able to do things like, what if we need tent hospitals? What if we need triage centers that need to be built very quickly? So I think people just need, it's different, I recognize that, but this is stuff that's been practiced and trained pursuant to the laws that protect us and protect our rights. And so it's different, but it's actually something that we envisioned because we knew in a pandemic state and locals would be overwhelmed relatively quickly, as we're seeing.
Yeah, as we're seeing just a few miles from here in New Rochelle. Doctor, President Trump is expanding the coronavirus travel ban. It starts on Monday night. You can't fly here from the United Kingdom or Ireland unless you're an American. But germs, they don't really know any boundary or citizenship. Is this too little too late? The virus is already here, so how does this make us safer?
Well, the cat is out of the bag, genie's out of the bottle. Here we are. We have the virus spreading in this country right now. So a travel ban is really not going to be all that effective at this point. It's like having a strainer. It depends, you know, you might take out some of the larger chunks, but you're really not going to be getting any of the finer pieces. And truly, at this point, I think we need to be focusing on things like social distancing, making sure that the people who are here or coming here that are staying in away from small groups, no large gatherings, all the things we keep saying. I think that travel ban is a little bit too little too late at this point.
Yeah, Juliet, we keep going back to Rudy Gobert, right? This NBA player. He tested positive for coronavirus. Within a few hours, the entire NBA season was suspended. Yeah. I'm wondering from you, what if a police officer tests positive in a major city and an entire department is then forced into quarantine? Who is then in charge of protecting people?
So this is, I mean, once again, it's no solace, but the potential loss of a workforce or in terms of public safety and public health has been envisioned. So obviously we want to protect our first responders, but the idea that it might be all hands on deck in either public health or public safety, I think, is not true. Some of them in particular will get sick, as we know. Many of them have kids, and if the kids are home. And also, we've seen in the past in other disasters, some of them won't show up. It's a small percentage. And so what we see going on now, I think, is a very, very serious, especially in police departments, focus on two things, on sort of workforce health, making sure people are healthy and that they are taking their temperatures. And secondly, and this goes back to us, don't bother them right now. In other words, another point of social distancing is take the burden off of public safety and public health. Don't get in your car. Don't get on a bike. Don't do all the things that often cause first responders to have to respond, and let them focus for a couple weeks. I mean, this is why it was important to cancel these big, you know, like the marathon here or a concert. Those are big burdens on public safety and public health as well. So we have it in us to also make sure that they're ready to protect us and sort of just stay put.
Yeah, still plenty more questions to answer. Unfortunately, that's all we have time for. Juliet Kayyem, Dr. Anne Rimoin, thank you so much. We appreciate it. Have a good Saturday night.
Thank you.
Of course. Thanks. Coming up, Washington State reporting 3 new deaths, along with more than